For gait deviations, the one that I'll be talking about is excessive plantar flexion, also known as ankle forefoot contact. So during this deviation, initial contact, loading response, mid-stance, terminal stance, and swing phases would be impacted. Because these phases are impacted, the functional tasks that would be affected include weight acceptance in the initial contact and loading response. Single limb support through mid and terminal stance is affected, as well as swing limb advancement through the swing phases. Their task accomplishments would also be affected, which includes shock absorption and forward progression, and stability in the initial contact and loading response phases. And this occurs because there is a lack of flexion at the knee, and this could decrease your shock absorption by hitting the ground without that smooth descent down. And there also may be some difficulty starting the gait cycle because there'd be a lack of a heel rocker due to the limited knee flexion and excessive plantar flexion during the loading response. Forward progression and stability in mid and terminal stance would be affected since there's a limited anterior progression of the tibia over the foot. There would also be issues with foot clearance and limb advancement in the swing phases due to that excessive plantar flexion. Potential causes of this gait deviation include a decrease in ankle dorsiflexion passive range of motion, inadequate strength of the pretibials. For gait, we know that we will need a pretibial strength of a 3 out of 5. The excessive plantar flexion can also be caused by knee hyperextension or a lack of knee flexion in stance. This also could be due to insufficient strength of the quadriceps. There may also be some impaired proprioception of the ankle, which could lead to this excessive plantar flexion.